Do you have pinching, pain, tightness, a bony block in the front of your hip? And does it happen when you go to bend over, lean forward in a chair, bring your knees together, or squat down deeply? If so, then you may have something called Femoroacetabular Impingement, also known as FAI or hip impingement. And in this video, I'm going to explain what hip impingement is, the different subtypes of it, and the anatomy behind why it ends up happening to you. Let's go ahead and start out by talking about the anatomy. So the hip is a ball and a socket joint, and the femur, which is your thigh bone, has a round head which acts as the ball part of that joint, while the acetabulum, which is part of your pelvis, acts as the socket that the ball goes into. And in a perfect world, what happens is that the ball is perfectly round and the socket covers the ball just enough that it keeps the hip stable, but not so much that it blocks or prevents our hip from moving. Also worth highlighting is that around the socket rim is a ring of cartilage called your labrum. And if you're familiar with what an O-ring in a jar is, the labrum works pretty similarly. It's there to help seal your joint and just keep things inside, and we'll come back to why this is important here in just a moment. Now, in hip or femoral acetabular impingement, what happens is that the bones of the hip joint are not perfectly shaped. So either the ball, the socket, or some combination of both is not perfectly congruent. And that lack of congruency ends up causing the bones to rub against each other more than what we would really prefer. And that's what causes the hip impingement. And we subclassify that hip impingement into two, but kind of three main categories, depending on which specific part of the bone is abnormal. It can be due to something called a cam deformity, a pincer deformity, or a combination of both, which is just called mixed type. We're going to go ahead and talk about each one by one. First, let's go ahead and talk about the cam deformity. So this is an issue with the ball, so the femur or thigh bone part, and is most commonly something we see in young athletic males. And in the subtype, instead of the femoral head being perfectly round, it has a bony bump at a part of the femur called the neck of the femur. And going back to what I said earlier, normally the ball of the femoral head is able to spin really pretty smoothly in a circle inside the hip joint. But if we have this bony bump, that ends up messing up that ideal smooth circular shape. And so then things can't spin so easily or fluidly. And so what instead happens is that when you go to flex your hip, which is just the medical term for bringing your thigh up closer to your chest, then that bony bump on the femoral neck can jam into the edge of your socket. And so when you go to bend over, lean forward in your chair, squat down, whatever else, and you get that pinching or that bony block, that is what you are experiencing and what is happening. Now, the second one is called the pincer deformity. And this one is most commonly seen in middle-aged females. And in this case, the issue is with the socket, so that acetabulum or that part of your pelvic bone. And the issue here is either the socket is too deep or the socket is tilted backward. And either of those variations end up meaning that the socket covers too much of the ball of the hip or femur. And because the socket ends up overhanging too far, when you go to move your leg, the neck of your femur will bump into that bony overhanging rim earlier on in the motion than it normally would, and so you end up with the pinching, the block, or pain. And finally, the third type is called mixed type impingement. And this is when you actually have both a cam and a pincer deformity. And surprisingly, it's actually the most common presentation that we see in the vast majority of cases. Now, after hearing all of this, a natural question you probably have is, why does the cam or the pincer deformity even come about? Because it seems like kind of an error in the hip, right? Well, there are two main reasons for why it ends up occurring. The first one is just genetics. Although humans do have the same general bone and muscle makeup from one person to another, there is actually a ton of natural variation between people as to how specifically their bones are shaped, where their ligaments connect, where their tendons or nerves run, and so on. And even among these natural variations, the hip joint is actually arguably the area where we have the most natural variation between people. There are absolutely enormous differences from one person to another regarding how long their femur or thigh bone is, the angle at which the femur enters into the socket or the acetabulum, how wide the pelvis itself is, and so on. With the takeaway from that just being that some people are realistically just built to where they're going to have problems. It's nothing they did, it's nothing that happened, it's just the genetics they got. However, reason number 2 is actually something that we can influence. There are certain activities we do when we're growing up that causes our hips to form in this kind of way. People who play certain sports, like hockey, when they're a kid, are more likely to have this problem. And the reason for that is that when you play sports like hockey, the bones of your hip will bump into each other more often than they normally would. And if you do this as a kid, when you're still growing, what will happen is that your body will try and adapt to that stress in response. And it does this by forming more bone at those locations, essentially in an effort to try and protect itself. And so the result here is just that your body may have formed a cam deformity just simply in response to the hip joint stress that comes with playing hockey, soccer, or something similar. But that also raises the question of why does the bony contact cause pain? Because in theory, you may be 30 right now, but have had this issue, had this hip shape since you were a child, right? Because it happens early on, or you're born with it. To answer that question, it's important to understand that the bone bumping into bone isn't usually actually what hurts directly, though it can be a factor. Instead, the pain is thought to happen because the repetitive collision between the bone damages the soft tissue structures that are also between the bone, like the labrum or cartilage I mentioned earlier, so that O-ring thing I talked about. The idea here is that the increased bony contact between, again, the bones is thought to lead to increased stress and then premature degeneration or tearing, so earlier than would be expected, wearing down of your labrum or the O-ring cartilage. And that wearing down is what is thought to be the cause of pain. But the most important thing for you to take away from this video is to know that not everybody with a cam or with a pincer deformity gets pain or problems. In fact, barely anybody actually does. Research shows us that most people, specifically 34 out of every 35 people, so again, basically everyone who has a cam or a pincer deformity on imaging will never, ever have pain or problems. Instead, only 1 out of every 35 people with this will ever get pain due to it, so less than 3%. And that discrepancy is why there's some confusing medical terms you may hear thrown around, like hip impingement morphology versus hip impingement syndrome. And it's kind of semantics, but basically syndrome is when we get pain that fits into the pattern I mentioned before of the knees across the body, turning the legs in, so on and so forth. Whereas morphology is just describing anybody who has a cam or a pincer deformity on imaging, so when we get an x-ray of you, regardless of whether or not they have pain or problems related to it. Which is to say, you can have the morphology without having the syndrome. Now, the exact reason why some people get pain from this anatomical variation, so the morphology, while others don't, is honestly really complicated and requires an entire other video to explain. The key point I just want you to take from that 1 out of 35 people getting pain statistic is that having a cam or a pincer deformity does not guarantee that you will have pain or problems. And it also means that even if you have pain currently, it is very likely that you can become pain-free without needing to surgically change or do anything. So I hope this video answered your questions and gave you a better understanding of the condition. In future videos, I will talk more about treatment, and in the meantime, good luck with your recovery.